diagnosis exam, make sure that your tools are already prepared and your patient is seated comfortably. And before and after examining your patient, always practice hand hygiene. Hi, my name is Alan. I'm a second year medical student. May you know your name, please, and age?
I'm Raluday, 25 years old.
Okay. This head-to-toe physical examination will be part of my final exam for the physical diagnosis subject, and everything will be video recorded. Would that be okay with you?
Yes.
Okay. We will begin your physical exam by getting your blood pressure. In getting the blood pressure of the patient, make sure that your patient is sitting with feet on the floor and position the antecubital crest at the heart level. Okay, and since Korotkov sounds are relatively low pitch, I will be using the bell of my stethoscope. Okay, now inflate. Okay, your blood pressure, sir, is 110/70, which is fine. Okay, we will now proceed with your eye exam. First, I will be checking your conjunctiva and sclera. Please look up. Okay, conjunctiva pink and sclera is white. We will now do the pupillary reaction to light. Please, please follow this finger as I shine a bright light obliquely to your pupil. Okay, your pupils are equally round and reactive to light. We will now do the corneal reflex. Can you please look up and to your left? Okay, very good. Can you please look up to your right? Okay, very good. You have good corneal reflex. Now we will do the cardinal directions of gaze. Please follow this pen with your eyes without moving your head, okay? Okay, you have good coordination with your rectus and oblique muscles with no signs of paralysis. Now, lastly, for the eye exam, we'll do the convergence test. Follow this pen as it approaches the bridge of your nose. Okay, very good. You have good convergence. Now, for your facial muscles, can you please raise your eyebrow and frown, puff your cheeks, and then smile for me. Okay, do not notice any facial weakness and unilateral paralysis. We will now proceed with your nose. We will first test your sense of smell. Please occlude your left nostril and sniff. Now your right nostril and sniff. Okay, do you find any difficulty sniffing? Okay, very good. Now with your eyes closed, please occlude your left nostril. And please identify this odor presenter. Okay, very good. Occlude your right nostril and sniff. Okay, you have a good sense of smell. I will now inspect for your nares. Okay, your nasal mucosa is pink and septum is midline. I will now palpate for your sinus tenderness. Please tell me if you feel any pain, okay? We'll first do your frontal sinus, and then your maxillary sinus. Is there any pain? Okay, there is no tenderness noticed as well. Now for your tongue movement, can you please protrude your tongue? Then move them from side to side, and then push your tongue against your cheek from the inside. Okay, the other side. Okay, your tongue is symmetric with no deviation. Now I will inspect your oral mucosa. Can you please open your mouth? Okay, your oral mucosa is pink. Dentitions are good. There's no ulcerations and no loose. We will now do the gog reflex. This will be a little uncomfortable, but this will be quick, okay? Okay, very good. Your gag is intact. Okay, next will be your muscles of mastication. I will be palpating them, and please tell me if you feel any pain, okay? Can you please say ah? Okay, can you clench your teeth? You know, please open your mouth as I palpate your pterygoid muscles from the inside. Okay, very good. Didn't notice any tenderness? Okay. Now we will do the range of motion of your temporomandibular joint. Can you please open and close your mouth? Okay, move your jaw from side to side, and then place your lower teeth in front of your upper teeth. Okay, very good. Next is to inspect the ear canal and your eardrum using this otoscope. Okay, I did not notice any discharge, swelling, and redness. I will now do the assess your hearing by doing the whispered voices. I will be standing 2 feet behind you and will be whispering a combination of letter and number, and will ask you to repeat them after me. I will upload the non-tested here. Okay, 0, 1, okay. 0, 1, okay. Okay, very good. I will be repeating this to your other ear. And now, let's palpate for your lymph nodes. Starting at your pre-auricular. Please tell me if you feel any pain while I'll palpate, okay? Your posterior auricular, your occipital, your tonsillar, your submandibular, submental, your superficial cervical, your posterior cervical chain, deep cervical chain, and then your supraclavicular chain. Okay, is there any pain? Okay, I didn't notice any enlargement and swelling. Okay, now I will now palpate for your thyroid gland. Please try to swallow your saliva. Okay. The isthmus is palpable and lobes are not felt. I will now inspect for your tracheal position. Okay, can you please swallow your saliva? Okay, trachea is midline. Now let's proceed with your posterior chest and lung. Can you please remove your shirt and face the back? Okay, I will first inspect for any impaired respiratory movement. Can you please inhale and exhale for me? Okay, very good. There is no it is symmetric and no deviation, and there is no impaired respiratory movement. Okay, I will now palpate doing the chest expansion. Can you please inhale and exhale? Very good. You have good chest expansion. I will now proceed with the percussion for resonance of your lung. Okay, I will do this in a ladder pattern. Okay, your lungs are resonant. I will now auscultate for any breath sounds. Please cough twice for me. Okay, now while I'll auscultate in a ladder pattern, please breathe with your mouth open, okay? Okay, your breath sounds are vesicular, soft, and relatively low pitch with longer inspiratory sounds. Okay, can you please lie down? We will now check your jugular venous pulsation. Okay, the head should be at the 30 degrees level. Okay, I will try the tangential lighting. Jugular venous pulsation is normally diminishes during inspiration, and it is normally non-palpable. Okay, your jugular venous pulsation is less than 3 cm above your sternal angle. Now I will inspect the anterior chest for any deformities and asymmetry using tangential lighting. Okay, so far it's all good. Now I will auscultate for murmurs and extra sounds of your chest. I will begin auscultating from the apex using the bell of my stethoscope. Then I will proceed upward to the left and right second intercostal spaces. Okay, now I will now palpate for your point of maximal impulse. Okay, your PMI is stopping 1 cm lateral to your mid-clavicular line at the 5th intercostal space. I will now inspect for your abdomen. We are now in your abdomen. We will check for any scars, striations, or dilated veins. In your case, there is none. So I will proceed with auscultation for any bruit or and friction rub, as well as I will be listening for your bowel sounds. I will auscultate bruit at your renal arteries and aorta, as well as your iliac arteries, and lastly your femoral arteries. Okay, for your friction rub, I will also be auscultating it over your liver and over your spleen. Now I will be listening for bowel sounds. Okay, so far I did not notice any bruit or friction rub, and your bowel sounds are clicks and gurgles, and normally the frequency of the bowel sounds is 5 to 34 per minute. Okay? I will now percuss for the 4 quadrants of your abdomen. Tympanic, 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 dull. Okay? Now I will palpate for the 4 quadrants of your abdomen. First, I will do light palpation. Please tell me if you feel anything while I palpate. Okay, now I will do the deep palpation. Okay, is there any pain? Okay, so far it's soft, non-tender, and I did not palpate any masses or hepatosplenomegaly. Now you please sit up. I will now percuss for your kidney tenderness or for the costovertebral angle tenderness. Please tell me if you feel any pain. Okay, was there any pain? Okay, there's no costovertebral angle tenderness as well. Okay, can you please face in the front? We will now inspect for your shoulder girdle. We will be inspecting for any deviation or fasciculation as well as asymmetry. So far, it's symmetric and there is no deviation or fasciculation. Now we will do the range of motion of your shoulder girdle. Okay, can you raise your arms in front of you and overhead? Okay, raise your arms behind you. Raise your arms to the side and overhead. Okay, cross your arms to your chest, and then with one hand reach it at the back, reaching your scapula, and then lastly raise your arms to the shoulder level, bend your elbow, and rotate your forearm towards the ceiling. Okay, very good. You have full range of motion. Now let's do your trapezius strength. For your trapezius strength, try to shrug up both your shoulder as I apply pressure. Okay. Very good. Your trapezius muscle strength is 5/5, which is good. Now we'll do the composite test, beginning the external rotation resistance test. Can you please abduct and flex your arm to 90 degrees? Yes. With your thumbs pointing upward, and as I apply pressure, please try to resist outward in an external motion. Thank you very much. Okay. Now, let's do the empty can test. Please raise your arms to 90 degrees and then point your thumb downward like this. And then as I apply pressure, please try to resist. Okay, but you have good composite test. I will now palpate your brachial pulse, which is located at the medial to your biceps tendon at the antecubital crest. Okay, it's brisk. Now I will palpate for your olecranon process. Please tell me if you feel any pain. Okay, there is no swelling, notice, and tenderness as well. Now for your elbow range of motion, please flex your elbow and then extend your elbow. In this zero position, try to pronate your elbow and then supine. Now I will palpate your wrist joints, your snuff box, and your MCPs or metacarpophalangeal joints. Please tell me if you feel pain while I palpate. Can you please abduct your thumb? Okay, now for your MCPs. Okay, is there any pain? Oh, there is no swelling and tenderness notice as well. So for the range of motion of your wrist, with your palms down, and you point your fingers to the floor, point your fingers to the ceiling, towards the midline, and away from the midline. Okay, you have full range of motion of your wrist. Now for the hand grip strength, can you please grab these 2 fingers and then pull? Okay, very good. You have good grip strength. Now, would you please lie down as I palpate for your knee effusion. I will be doing the balloon sign for me as a major effusion test. Okay, I do not notice fluid wave. Is there any pain? There is no tenderness as well. I will not palpate for your popliteal fossa. I will slightly flex your knee and then please relax your leg. Okay, popliteal pulse is brisk. Okay, now we will do the range of motion of your ankle and foot. Can you please direct your foot to the floor, up to the ceiling, and then bend your heels inward, then outward. Okay, very good. You have full range of motion of your ankle and foot. Now for the last two, I will palpate your dorsalis pedis pulse and your posterior tibial pulse. First, the dorsalis pedis pulse. Now I will palpate your posterior tibial pulse. Okay, both pulses are brisk or normal. So that would end our physical diagnosis exam. Would there any questions? Okay, very good. So always remember before and after examining your patient, make sure to practice good hand hygiene. And that would be all, Doc.